what your feet say about your health. Cold feet, many culprits. If your toes are always cold, one reason could be poor blood flow, a circulatory problem sometimes linked to smoking, high blood pressure, or heart disease. The nerve damage of uncontrolled diabetes can also make your feet feel cold. Other possible causes include hypothyroidism and anemia. A doctor can look for any underlying causes or problems or let you know that you simply have cold feet. Foot pain. When feet ache after a long day, you might just blame on your shoes. After all, 8 out of 10 women say their shoes hurt. But pain that's not due to sky high heels may come from a stress fracture, a small crack in a bone. One possible cause is exercise that was too intense, particularly high impact sports like basketball and distance running. Also, weakened bones due to osteoporosis increases the risk. Red, white, and blue toes. Raynaud's disease can cause toes to turn white, then bluish, and then redden again and return to their natural tone. The causes is a sudden narrowing of the arteries called vasospasms. Stress or changes in temperature can trigger vasospasms, which usually don't lead to other health concerns. Raynaud's may also be related to rheumatoid arthritis, Sjogren's syndrome, or thyroid problems. Heel pain. The most common cause of heel pain is plantar fasciitis, inflammation where this long ligament attaches to the heel bone. The pain may be sharpest when you first wake up and put pressure on the foot. Arthritis, excessive exercise, and poorly fitting shoes also can cause heel pain, as can tendonitis. Less common causes include a bone spur on the bottom of the heel, a bone infection, tumor, or fracture. Dragging your feet. Sometimes the first sign of a problem is a change in the way you walk, a wider gait, or slight foot dragging. The cause may be the slow loss of normal sensation in your feet brought on by peripheral nerve damage. About 30% of these cases are linked to diabetes. Nerve damages also can be due to an infection, vitamin deficiency, and alcoholism. In many cases, no one knows what caused the nerve damage. Other possible causes for foot dragging include problems with the brain, spinal cord, or muscles. Clubbed toes. In clubbing, the shape of the toes and often the fingers changes. The nails are more rounded on top and curve downward. Lung disease is the most common underlying cause, but it also can be caused by heart disease, liver and digestive disorders, or certain infections. Sometimes clubbing runs in families without any underlying diseases. Swollen feet. This is usually a temporary nuisance caused by standing too long or a long flight, especially if you are pregnant. In contrast, feet that stay swollen can be a sign of serious medical condition. The cause may be poor circulation, a problem with the lymphatic system, or a blood clot. A kidney disorder or underactive thyroid can also cause swelling. If you have persistent swelling of your feet, see a physician. Burning feet. A burning sensation in the feet is common among diabetes with peripheral nerve damage. It can also be caused by vitamin B deficiency, athlete's foot, chronic kidney disease, poor circulation in the legs and feet, peripheral arterial disease or PAD, or hypothyroidism. Sores that don't heal. Foot sores that will not heal are a major warning sign for diabetes. Diabetes can impair sensation in the feet, circulation, and normal wound healing, so even a blister can become a troublesome wound. Those sores also are prone to infection. Diabetics should wash and dry their feet and check them for any wounds every day. Slow healing of sores also can be caused by poor circulation from conditions such as peripheral artery disease. Pain in the big toe. Gout is a notorious cause of sudden pain in the big toe joint, along with redness and swelling. Osteoarthritis is another culprit that causes pain and swelling. If the joint is rigid, it may be hallux rigidus, a complication of arthritis where a bone spur develops. Finally, turf toe is an element of athletes, particularly those who play on hard surfaces. It's caused by an injury to a ligaments surrounding the joint. Pain in the smaller toes. If you feel like you are walking on a marble, or if pain burns in the ball of your foot and radiates to the toes, you may have Morton's neuroma, a thickening of tissue around a nerve, usually between the third and fourth toes. It is 8 to 10 times more common in women than in men. It is caused by injury or too much pressure on the toes. Itchy feet. Itchy, scaly skin may be athlete's foot, a common fungal infection, a reaction to chemicals or skincare products called contact dermatitis can cause itching too, along with redness and dry patches. If the skin on itchy feet is thick and pimple-like, it may be psoriasis, an overreaction of the immune system. Medicated creams can relieve the symptoms. Claw toe. This foot deformity can be caused by shoes that are tight and pinch your toes, or by a disease that damages nerves such as diabetes, alcoholism, or other neurological disorder. Your toes will be bent upward as they extend from the nail of the foot, then downward from the middle joint, resembling a claw. They may respond to stretching and exercises of the toes, or you may need special shoes or even surgery. Foot spasms. A sudden sharp pain in the foot is the hallmark of a muscle spasm or cramp, which can last many minutes. Overwork and muscle fatigue are common causes. Other causes include poor circulation, dehydration, or imbalances in potassium, magnesium, calcium, or vitamin D levels in the body. The changing hormone levels of pregnancy or thyroid disorders may play a role. If spasms are frequent or severe, see a doctor. Strengthening exercises can help with muscle fatigue. Dark spot on the foot. We associate skin cancer with the sun, so we are not as likely to check out feet for unusual spots. However, melanoma, the most dangerous form of skin cancer, can develop in areas that are not regularly exposed to the sun. Melanoma can even appear beneath the nail, where it might look like a black spot. Yellow toenails. Your toenails tell a lot about your overall health. A fungal infection often causes thickened yellow toenails. Thick yellow nails also can be a sign of underlying diseases including lymphedema, swelling related to the lymphatic system, lung problems, psoriasis, or rheumatoid arthritis. Spoon-shaped toenails. Sometimes an injury to the nail or frequent exposure to petroleum-based solvents can create a concave spoon-like shape. However, iron deficiency also can cause this unusual shape. White nails. Injury to the nail or illness anywhere in the body can cause white areas in the nails. Part or all of a nail separates from the nail bed, as shown here. It can appear white and may be due to an injury, nail infection, or psoriasis. If the nail is intact and most of it is white, it can sometimes be a sign of a more serious condition, including liver diseases, congestive heart failure, or kidney disease. Talk with your healthcare provider about any concerns. Pitting of the nails. Pitting or punctured looking depressions in the surfaces of the nail is caused by a disruption in the growth of the nail at the nail plate. It affects as many as half of people with psoriasis. Thank you for watching. If you like the video, please like, share, and subscribe for more informative videos. Thank you.